Did you know October is ADHD Awareness Month and Breast Cancer Awareness Month? Only the most successful awareness campaign in the history of ever. I mean, with good reason though, cancer is horrible. But can you see why we ADHDers may not have the public awareness we deserve? Look at our competition. We can't compete against cancer. It seems as though a fair amount of people have a grave misunderstanding about what ADHD truly is. Even if you have it yourself, there's a good chance that you may not know just how much of your life it can really affect. I know I didn't until I did a whole bunch of research. That's why in this video, I'm going to dive deep into what ADHD exactly is and show you what makes the ADHD brain tick. Coming up. Hi, I'm Daniel, and this is Journey to Wellness. And here on this channel, I like to bring awareness to ADHD in adulthood and talk about what it's truly like to have it. If you're new to the channel, consider hitting that subscribe button and the notification bell so you don't miss out on one of my videos. Now let's jump into today's video. Chances are you've heard of the term ADHD, and unless you've done some in-depth research, know someone close to you that has it, or have it yourself, in my case all three, chances are you probably understand it as something that hyper little boys have that causes them to behave badly. Or at least that's what their mother said when they were throwing a tantrum in the middle of the cereal aisle in the grocery store. Now, while age-inappropriate behavior is a part of ADHD, it's definitely not the whole story. ADHD stands for Attention Deficit Hyperactivity Disorder. This is a terrible name. Not necessarily because of the word disorder, it is that, but because in essence, it's really misnamed. We don't exactly have a deficit of attention. We have just about as much attention as the next person does. The problem that we have is that we cannot regulate our attention and keep it focused in the direction that we intend it to. Our attention gets pulled from one place to another without our control, and regardless of how much we want to stay focused on a single task. At other times, our attention is so laser focused, usually on something that isn't very important, we can't pull ourselves away from the thing that we're doing, even to do more important things like eat or use the bathroom. This is what a lot of ADHDers call hyperfocus, and it's actually a part of ADHD that a lot of us tend to like. The problem is, this is a double-edged sword, because we usually wind up ignoring things that are important or other people that are important to us to continue working on whatever it is right in front of us. In actuality, this is what's known as perseveration, which is a problem with shifting tasks appropriately according to a given situation. This is actually a symptom that's typically related to a form of brain injury. This is something I know all too well. As I was writing the script in preparation for this video, I should have actually been getting ready to go to bed. Another reason why ADHD is poorly named is because of the hyperactivity component. This only applies to some of the ADHD community, and it mostly applies to younger boys, although girls can be hyperactive as well. Either way, hyperactivity tends to fade as one gets older and it becomes more internalized. A hyperactive adult may look more like what you would think of as a type A personality, or a constant internal restlessness that just doesn't seem to go away, not allowing you to sit and rest because you feel like something's always got to be done. The Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, is the book used by doctors to match a series of symptoms up with a diagnosable disorder. It tries to address the differences in ADHD by introducing presentations. There are 3 different presentations of ADHD, primarily inattentive, which is what I was diagnosed with, primarily hyperactive, and combined type, which is, you guessed it, a combination of both. To learn more about the differences in these presentations and to learn the difference between ADD and ADHD, check out the video right here. Now, most adults will be diagnosed either as combined type or primarily inattentive. As like I mentioned before, hyperactivity tends to subside with age, though for some it can persist into adulthood. The DSM-5 summarizes ADHD as a persistent pattern of inattention and/or hyperactivity and impulsivity that interferes with functioning or development. Now this summary is okay, but it doesn't really grasp the magnitude of the ADHD experience. See, ADHD is a condition that affects nearly every aspect of one's existence, such as important decision-making, future planning, relationships, friends, family, and romantic, work and school performance, time management, money management, and emotional control, just to name a few. Now, these are areas of life that anybody and everybody can have trouble with from time to time. The difference is, ADHD doesn't just pop up overnight. It's a lifelong thing with a history of impairment. Much like a tornado, it leaves a long path of destruction in one's life, especially if left untreated or unaddressed. So how do we know that it isn't just laziness or bad behavior that we're dealing with? Well, for that, there's plenty of supporting research that shows that ADHD is a mostly genetic, brain-based neurodevelopmental disorder. Now, that's kind of a mouthful, so let's take a second and break down what that statement really actually means. While it's not fully understood yet, ADHD is shown to be closely linked to genetics, meaning that it's biological in nature, which means that, with the exception of some rare cases, ADHD isn't something that you get, you're born with it. Social factors or influences, such as living environment, availability of resources, or comorbidities, they don't cause ADHD, although they can play a role in the impact and the severity of the impairment. But keep in mind, this also holds true for neurotypical people. So the next time someone tells you that ADHD is nothing but the results of bad parenting or a lack of discipline, tell them they need to read a medical journal sometime and just realize that you're dealing with somebody that has no idea what they're talking about. The second part of that statement tells us that ADHD is brain-based, which means that it's caused by the physical organ not functioning the way that it should. Not too dissimilar from the way a diabetic's pancreas doesn't produce insulin the way that it should. Obviously, the main difference being that if ADHD is left untreated, it's not inherently fatal. Although recent information has shown that ADHD can greatly reduce your life expectancy. To see what I'm talking about, check out this video right here. Now, being that ADHD is brain-based, it's not subject to the comings and goings that you have with the mood disorder. Depression is something that can come and go due to a myriad of factors, while ADHD remains constant. The only thing that changes the impact of ADHD, other than medication, is how the environment is structured. This is generally referred to as scaffolding or a prosthetic environment, an external set of structures that makes living with the condition a lot more manageable, much like a ramp is for someone in a wheelchair. It doesn't make the condition go away, but it does make the condition a lot more easier to live with and a lot less impairing. And the third part of that statement is that ADHD is a neurodevelopmental disorder, meaning that the neural networks involved are underdeveloped. In fact, it's been shown that the self-regulation development of someone with ADHD is around 30% slower than that of a neurotypical. So when you're looking at the impulse control of someone that's 10 years old, you're really dealing with the impulse control of that of a 7-year-old. And a 16-year-old that's learning how to drive, they're going to have the decision-making capabilities of an 11 or 12-year-old. Now, we've actually been able to pinpoint the neural networks involved that are underdeveloped with ADHD. So if someone ever tells you that we don't know where in the brain ADHD comes from, you'll know that you're dealing with someone that is severely misinformed. There are 5 areas of the brain whose development is affected by ADHD. The primary culprit for this is the frontal lobe, or the prefrontal cortex. It's the area of the brain that's right behind the forehead. It also just so happens to be the part of the brain that is responsible for all of your executive functions. To learn more about executive functions and what they are and what they do, check out this video right here. Basically, the prefrontal cortex is the self-regulation center of the brain. It's responsible for many functions, including working memory, motivation, planning, problem solving, judgment, impulse control, attention, time perception, ability to delay gratification, decision-making, and social behavior, among many other functions. Now, while most of the attention is focused on the prefrontal cortex, there are other parts of the brain that are affected as well. These include the basal ganglia, which is primarily responsible for inhibiting physical motor movement. The cerebellum, which coordinates movements. Believe it or not, we tend to be a little bit on the clumsy side. This may explain why. The anterior cingulate plays a big role in regulating emotions, and the corpus callosum connects the left and right hemispheres of the brain. Fun fact, on average, our brain volume is around 3% less than that of a neurotypical brain. But at its core, ADHD is widely believed to be a dopamine and norepinephrine problem, in that our brain doesn't produce enough of these neurotransmitters. Neurotransmitters are the chemicals in our brain responsible for carrying signals between nerve cells. See, nerve cells in our brain are not actually connected by anything. There's a small gap in between them, and the ends of nerve cells look something like this. Where you have two nerve cells coming together, there's a gap in between them. That's called your synaptic gap. And what happens is low voltage electricity runs through the end of the nerve cell, and it triggers transmitters from one nerve cell to the other. Now, the signals used to bridge this gap are your neurotransmitters, and that's going to be dopamine and norepinephrine, as well as about 50 other more chemicals that are used throughout the brain. But in the ADHD brain, it's suspected that we don't produce enough of these chemicals, or we reabsorb them too quickly. So what happens is the electrical signal runs through the end of the nerve, it triggers the transmitters on one side of the synaptic gap, and it triggers these chemicals to be released, and they go to the other nerve cell. And on this side, there are receptors that are specially designed to receive that chemical signal. And if the signal is strong enough, it continues on to the next nerve cell. And this pattern gets repeated billions of times throughout the brain. In an ADHD brain, however, we either don't produce enough norepinephrine and dopamine to cross this synaptic gap, or we have what's called reuptakes on the transmitting side. Now, this is true for everybody. We all have these reuptake valves. And what that does is if there's any extra chemicals left in between the synaptic gap, these reuptake components suck that chemical right back up. So in our brain, one of two things is happening. Either we're not producing enough of the chemical to cross that gap properly, or our reuptake is way too active and drawing that chemical back before a good connection can be made to pass the signal on. This is the exact mechanism that the stimulant medications work on. Medications that are amphetamine-based, such as Adderall and Vyvanse, they help increase the production of dopamine and norepinephrine to help cross that gap a little better. Methylphenidate products such as Ritalin or Concerta, they actually work on blocking these reuptakes to where it leaves more of the dopamine and norepinephrine in the synaptic gap to hopefully create a better connection. I've actually put together a playlist of some of the most common ADHD medications. You can check that out right up here. Now, to understand why there's so much focus around dopamine and norepinephrine, it's best to understand what these neurotransmitters actually do. Dopamine is typically known as the pleasure and reward chemical. Whenever we do something that we enjoy, such as play a game or talk to our love interest, or even exercise, our brain gets flooded with dopamine, and that helps reinforce our liking for that activity. So not only are we more apt to do it in the future, we actually look forward to it, giving us our motivation. Now, this is true for anybody and everybody, neurotypicals included. However, in an ADHD brain, this is the only way our brain works. We are interest-based only. In other words, if we don't have an inherent liking of it, we can't really get ourselves motivated to do things. Since we have a problem with delayed gratification, a neurotypical brain, however, doesn't. Because of this, they're able to use future reward as a strong motivation and something that brings on a lot of dopamine to help them be motivated to do things that they otherwise would find boring or didn't have an inherent interest in. Norepinephrine is known for regulating alertness and attention, as well as heart rate and blood pressure. It also regulates mood and cognitive arousal, and even speeds up reaction time. In a neurotypical brain, these chemicals flow properly, creating the motivation necessary to not only initiate important but mundane tasks, but also gives them the ability to keep sustained attention toward the completion of a goal whose reward is sometime in the future. An ADHD brain, due to the deficiencies in the abilities of these neurotransmitters, has a markedly more difficult time initiating tasks that are not inherently interesting to the individual, as well as sustaining focus and attention to a future-directed goal. We're creatures of the here and now, and damn it, it better be exciting. With all that being known, it's much clearer to see that what we're dealing with is a legitimate condition that can cause severe impairments in several areas. In seeing the wide array of affected areas, you may begin to understand why ADHD is really a terrible name for this condition, because it fails to capture the scope of the problems that it can cause in one's life. This is why I like the names proposed by Dr. Russell Barkley, self-regulation disorder and executive function disorder. They far more accurately describe what it is we're dealing with. So what are some causes of ADHD? While the majority of cases are genetic, there are some other suspected causes of the condition. ADHD has been linked to premature birth, or a mother smoking, or drinking, or even undergoing extreme stress while pregnant. All of these greatly increase the chances of a child being born with ADHD. But what about after birth? Is it possible to acquire ADHD? Well, about 1/3 of ADHD is actually acquired after birth and isn't linked to genetics. Around 5% can occur after birth, mostly due to severe head trauma. But other causes can be infections, treatment for leukemia, strep bacteria, and lead exposure. And while seizures with ADHD are not common, it's typically seen in the cases where ADHD is acquired. So how prevalent is ADHD? Well, around 11% of children are diagnosed, and we can only speculate as to how many go undiagnosed. The ratio of diagnosis for young boys and girls is in the neighborhood of 3 boys for every 1 girl. 75% of boys will be diagnosed as hyperactive, while around 60% of girls are going to be diagnosed as inattentive, making them far more likely to be misdiagnosed or overlooked altogether, even though they struggle just as much as any of the boys do. 40 to 60% of these children will have their ADHD all throughout adulthood. 4.4% of adults, that's over 10 million people, meet the criteria for a diagnosis of ADHD, although sadly, only around 20% will ever seek treatment. Because ADHD is typically more recognizable earlier on in men than in women, usually in childhood, men tend to be diagnosed and treated more often than women. Though over the years, many clinical reports show that the ratio of men and women seeking treatment is closer to 1-to-1, suggesting that ADHD is just as common in males as it is in females. But due to the presentation of symptoms, women are not discovered to have the condition till they learn of all the symptoms on their own, usually later in life. This would suggest, especially for the female population, that ADHD is severely underdiagnosed, contrary to some popular beliefs. This isn't to say that as a whole, ADHD is underdiagnosed. In some cases, it's overdiagnosed. But it is to say that there's a large portions of the population that would greatly benefit from a diagnosis and subsequent treatment, that are not receiving the help that they desperately deserve. Basically, ADHD in some cases is overdiagnosed. However, there are an equal, if not greater amount of cases that go undiagnosed. So what should you do if you suspect that you or someone you know has ADHD? While I'll be covering this topic in an upcoming video, I'll leave you with this. Do lots of research from reputable sources. I suggest chad.org or attitudemag.com for starters. I'll have links to these websites in the description below. I also suggest any information you can find from Dr. Russell Barkley, probably the foremost expert on ADHD in the entire world. His material is incredibly in-depth and may not be very ADHD friendly, as a lot of his videos are well over an hour. But if you want to have a true grasp and understanding of what ADHD is, I'll leave links to playlists of his in the description below. For a more ADHD-friendly resource that's here on YouTube, I suggest the channel How to ADHD. It has some really great pointers on how to live with and manage ADHD. I'll have that channel linked in the description below. Two great podcasts are from Dr. Ned Hollowell and ADHD coach Eric Tivers. Dr. Hollowell's podcast is called Distraction, very aptly named. And Eric Tivers' podcast is called ADHD Rewired and is solely focused on helping adults with ADHD. I'll have links to both in the description. The other thing you can do if you suspect you have ADHD is look for a psychiatrist that specializes in ADHD, or at least one who frequently treats adults with this condition. Now, this can be a little tricky because a lot of doctors will have ADHD listed as a condition that they treat, but unfortunately, it doesn't tell you how familiar they are with it. To get that information, you're going to have to learn how to become your own best advocate and ask the doctor point blank, how familiar are you with treating adults with ADHD? Do you see a lot of adult ADHD patients? One good resource for finding a psychiatrist and a therapist, which is highly recommended, is psychologytoday.com. You can filter the results based on which conditions you need to be treated for, as well as filter by the insurance each doctor accepts. Now, when you get the search results, make sure you read the description of each doctor. It will tell you a lot about whether or not they primarily see adults with ADHD or if they specialize in some other condition. If in their bio they mention specifically that they see adults with ADHD, that's a really good place to start. I'll have a link to this website in the description below. Question of the day: did you learn anything new about ADHD from this video? Tell me what it is in the comments section. If you think I left something out, tell me that too, as I love learning new things about ADHD. If you got value out of this, do me a big favor and smash that like button. And remember to subscribe for more and click that bell notification so you don't miss out on new videos. And until next time, take care of yourself and be well.